Hello friends, today in this video module of our online course in telemedicine and teleconsultation, we will be dealing with what are the benefits of telemedicine. And telemedicine, as all of you know, is also called as the teleconsultation, is also called as e-health, telehealth, digital health, and there are different names for the telemedicine. And by the definition, telemedicine means the delivery of a healthcare services by using the information and advanced technologies for the exchange of valid information for the purpose of diagnosis, for the purpose of treatment, for the purpose of prevention, for the purpose of research and evaluation, and the continuing education of healthcare workers. So now we are living in the era of telemedicine, where the era of techno world. And as all we are aware of robotic surgeries, now teleconsultation and telemedicine is the part of our life. Now we'll see what are the benefits, what are the advantages of the telemedicine in our day-to-day life in the health services. The most important benefit of the telemedicine is the saving of time and cost. By teleconsultation and telemedicine, we can save the time and cost of both doctor as well as the patient. For example, if a patient is staying far away from the distance, and he want to consult the specific doctor. So a patient is staying in the Andaman Nicobar and he want to consult a doctor in Mumbai. He can consult him by teleconsultation. The time is saved, the money is saved, and he can get the good opinion of that doctor. So this plays a very important role in saving of time and cost of both the doctor and patient. And at the same time, the load of primary health and secondary health is taken over by teleconsultation, and only for the tertiary health, or where hospital is the last stop, patient has to get admitted, and the workload in the overcrowded countries will be relieved by the use of teleconsultation, telemedicine. Telemedicine's another benefit is that it make a right expertise available everywhere. In case of any person want to take a appropriate diagnostic or appropriate second opinion of a specific doctor, by teleconsultation or telemedicine is it possible. If a patient is living in a rural area and he want to take opinion of a metro doctor, he can take the consultation, he can take the opinion of that metro doctor by the help of telemedicine. Another benefit of the telemedicine is the early provision of appropriate treatment and increased time access. It helps in the proper diagnosis, at the timely diagnosis, it helps in the timely treatment, and the patient's life can be saved by properly, adequately, timely consultation with the expertise doctor. It decreases unnecessary patient transfer from hospital to hospital. If a patient is admitted in some hospital, and that doctor wants some specialized opinion regarding his patient, instead of referring the patient from hospital to hospital, he can take appropriate opinion of an expertise doctor, and it decreases the unnecessary patients transfer from hospital to hospital. Telemedicine also helps in maintaining records and documentation, as it is a techno based communication between doctor and patient. It helps in maintaining the records and documentation of the patient, and doctor can also keep the record and documentation properly. Telemedicine plays a very important role in responding in emergencies. In case of emergency where the patient have no time, where patient doesn't give time for the doctor to treat him, and by taking a proper expertise opinion, we can save the life of a patient in a critical emergency conditions. Use of telemedicine in a primary and secondary health care reduces burden of tertiary health care. As all of you know, there are three health cares: primary health care, where it is done at the PHC level, primary health center level, in the rural area where doctors are not much available. Secondary care, it is done by the taluka places, district hospitals, civil hospitals, and the private doctors hospitals. And in tertiary healthcare, where all facilities are available, all doctors are available, that is possible in the medical colleges and big charitable hospitals and institutions. So it reduces the burden of both primary and secondary healthcare if we take a timely teleconsultation regarding any doctor, and only in case of tertiary we can, in tertiary also we can take use of the telemedicine in some emergency cases. Telemedicine, the one more important use of telemedicine is safety of doctors. In contagious diseases or in the pandemic conditions, like today we are going from the corona pandemic, and in such conditions it play a vital role in safety of doctors, safety of patients, safety of health workers in a lot of pandemic conditions and contagious diseases. Telemedicine also decrease the risk of hospital borne diseases. When if a patient is taking consultation from his home, he is taking medicine at his doorstep, so he doesn't has to go to hospitals, and patient can because of that there is a decrease in the risk of hospital borne diseases. Then because of timely consultation in telemedicine, the main advantages of because of timely consultation, it decreases the morbidity and mortality rate. So teleconsultation, timely consultation, that saves the life of the patient in case of emergencies, and that decreases the mortality and morbidity. So telemedicines have more advantages in such today's techno world, though physical action, there is no substitute to the physical examination, but in many conditions with the help of telemedicine we can give better and better health services.